Hi, my name is Dr. Robert Brannigan, and I'm a urologist at Northwestern Medicine in Chicago, Illinois, and I'm also a professor of urology and head of the Division of Male Reproductive Surgery and Men's Health at Northwestern University Feinberg School of Medicine. So today I'd like to share with you a case that I think encompasses a lot of the challenges that we face when dealing with young men with testicular cancer. This patient was an otherwise healthy 30-year-old male who noticed a lump or hardness in his right hemiscrotum after taking a shower. And so he contacted his internist, who saw him very quickly and arranged for a scrotal ultrasound. And that scrotal ultrasound showed numerous concerning findings within the right testicle, numerous areas of irregular echogenicity, areas that quite frankly look like multifocal tumors in the right testicle. So his internist sent him to us for further evaluation, and certainly when we saw him and examined him, he had very concerning findings with his right testicle being indurated throughout, and certainly very suspicious for testicular cancer. And I spoke to him about options. Certainly recommended that he consider a right radical orchiectomy. But we also at that time talked about his future goals or desires regarding reproduction. And again, he was a 30-year-old single male and had no prior children and definitely wanted to have children in the future. So while we were getting things organized for surgery, we sent him for semen analysis and sperm cryopreservation. And unfortunately, both of those semen tests that he did came back revealing no sperm being seen, including in the centrifuged pelleted sample. I should point out that at around that time, his serum tumor markers came back normal. So we regrouped with him and talked about one of the options that we offer our patients who have azoospermia at the time of cancer diagnosis. And the option is for an Onco-tese. And what we do is at the time of the radical orchiectomy, we take the removed testicle and in a backbench setting, perform an Onco-tese where we actually look at the testicle and look for sperm using an operating microscope. So he wanted to pursue that. So we went ahead and took him to the operating room and performed the right radical orchiectomy on him. And that went very, very well. And intraoperatively then, we handed off that removed orchiectomy specimen to ourselves, actually to a sterile backbench table, and began the Onco-tese procedure. I'm going to show you what that looks like here. We see in image 1 here, the specimen again on the back bench away from the regular OR table. And in the second image here, we actually see a close-up view of that right testicle, and it's laid out again beneath the operating microscope. In figure 3, we're coming into the field with our instruments underneath the operating microscope. And what we do then is we use our micro instruments and we bivalve the testicle and then search through the tissue using, again, the operating microscope and our micro instruments. And in panel 5 here, image 5, what we see is the bivalve specimen, and you can see the vast majority of the testicle has been replaced by tumor and inflammatory tissue. And it's only at the lower pole of the testicle did we find any seminiferous tubules that even remotely appeared normal. So what we did is we sampled those tissues and made what we call a wet prep slide there in the operating room. And you can see here we're taking that more normal looking testicle tissue in this next image and teasing the tissue apart. This is a sterile slide. And then what we do is we inspect that wet prep slide beneath a phase contrast microscope, which is shown in the next image here. And in the final image, we can actually see what we're looking at. And under 400x, we're actually looking at the minced testicular tissue. And what we found for this patient was 1 to 2 sperm per high power field. And the sperm did have twitching. And so while that's a really, really low number of sperm, in the era of IVF ICSI, it's more than enough to help facilitate future fertility. So we went ahead and froze that tissue and froze that specimen, and actually wound up getting 4 vials of testicular tissue that were frozen that we then had available to him to use down the road. So, he made it through his surgery very well, had an uneventful recovery. He had imaging after the surgery showing no evidence of any metastatic disease and wound up just having surveillance. The specimen did reveal pure seminoma and all the margins were negative. And so he did quite well in terms of his recovery from the cancer surgery. And about 2 years later, wound up getting married, and he and his partner decided to pursue a pregnancy. Now, as a next step, we sent him for an additional semen analysis, in fact, 2 semen tests. Both of them showed persistent azoospermia. So he was really very grateful then that we had frozen the sperm at the time of the Onco-tese. And so he and his partner turned to that frozen testicular tissue and wound up using that in IVF. And so at the first attempt with IVF, he and his wife conceived a pregnancy with a son, it turned out. And the pregnancy went very well, and they were able to enjoy the birth of that son at full term at 40 weeks, and he was a healthy baby boy.